I got licensed first, and then I found out where the vet offices were. And the first vet I run into told me they didn't want a horse dentist around there. They didn't need one. I said, "Oh boy, I'm in for it here." And then I drove around the building, and there was a fellow standing there, and I said, "You know, does you work for a vet?" He says, "Yep." I says, "I'm a tooth man," and I said, "If you need anything, you better believe it. Dr. Belden will be here in about 5 minutes." He says, "You just wait right here." And when he got there, he says, "You got to go up." He named the barn. He's Irwin Hamilton from Canada. He says, "Got a horse has a molar, needs to be cut off." He says, "You got cutters?" I says, "Yeah." Well, I found out how to use my cutters on that first tooth I cut because that was the big deal. And the old veterinary saying is you'll miss more by not looking than not knowing. And when I looked in there, I saw three lower teeth on the lower right into the upper flesh with no teeth but little white dots in the gum line. And I said, "These teeth are too long. They got to be cut off." Well, I didn't know anything about cutters other than the one tooth I cut, so I had to kind of experiment. The same cutter I used on that horse on the track didn't fit, and I had dropped down. And the way the cutters were made, the handles come together, and it didn't take long to figure out that there's a reason for that. And it's not for cutting your finger off, which you will do if you get it in between. And I dropped down two sizes, and it fit on the front tooth. And when I cut it, it didn't come. So I twisted it, and out it came. This was we found out later about a 30-year-old horse, so it wasn't much of a tooth. But I had cut off the first root, and the second and the back root came with the tooth. Well, I didn't want him to know. The manager was standing behind me, so I didn't want him to know I didn't know what I was doing. So I took the same cutter and I reached in on the next tooth, grabbed it, and I twisted it out, and I grabbed the next tooth, and I ended up pulling all three teeth with the cutters, which I could have easily pulled with extractors, but I had to kind of bluff my way through this so I didn't look too stupid. And that's how it all started. And the bottom line is, if I hadn't have bought those old antique tools, I wouldn't have had them to work with and probably never could have fixed it. So my word to everybody that I've worked with is get a set of cutters. And that was one of my biggest lectures when I started lecturing is how to use the cutters. And now the cutters are not really cutters. They're shearers. And what you do when you cut a tooth, you're actually shearing it in what is known as a controlled fracture. And you have to be within a hand grip of those handles to know you're on the right tooth with the right cutters or shear. But there's a way to use those tools. And if you don't, like I figured it out, you can have a disaster because it's very easy to split a molar all the way to the end of the root if you're not on it with the right cutter and the right angle. So, after that, I got a reputation for saving skinny, starving geriatric horses. And the whole secret was making them pain free. And that uh, I ended up pulling most geriatric teeth, and the horse I did at the orphanage gained about 300 pounds, and was probably the most remarkable change I've ever seen. from a skin and bones horse to a fat, slick show horse.